Okay, yes. Cool. One thing, they have one specific classical feature of right-sided heart failure. So let me make a good, okay, let me make your lungs. This is your beautiful lungs. Everyone have two lungs, okay? And this is your heart. Everyone they have heart, okay? So what is happening? Superior vena cava, inferior vena cava? Yes or no?
Yes, ma'am.
Okay, this is your right atrium, right ventricle. From your right ventricle, the blood is moving out into your lungs. Yes. Through your pulmonary.
Pulmonary
vein.
vein.
Who just tell me, vein or artery?
This is pulmonary artery, ma'am.
Very good. Pulmonary. This is pulmonary artery or vein?
Artery.
Pulmonary artery.
Artery.
Okay. So anything which takes blood away from your heart is called vein. I know you have in your childhood, you must have heard that, okay, the veins contain deoxygenated blood and arteries contain
Oxygenated.
oxygen. But this is a very misnomer. Like, honestly speaking, when we studied, like when anatomy was being written on the books, when earlier the doctor and the scientists, basically doctors, physician, they started understanding the human body, and in the literature, they have, if I'm talking like very, very in depth, and you have to understand this thing. So when they started writing literature about human body, they have said that anything which is carrying blood away from the body, we will call it a vein, and anything which is bringing back to the heart, we will call it artery. Okay.
No,
So
ma'am, is it?
I'm
Ma'am,
saying
no, ma'am,
either,
bringing back to the heart is vein.
yes. When
Yes,
anything which is bringing back to the
heart is vein and taking away is artery.
anything which is taking blood away from your body is your artery. Artery, and which is bringing back to your heart is just called vein. So this was the actual concept of naming the vessels. Okay, so that's why this blood is taking blood out of the heart. That's why it is called as artery. Okay, artery. And this is called bringing blood back to your heart. That's why this is called as pulmonary vein. Now you understand?
Yes, ma'am.
That's why. Okay, so understand one thing. So superior vena cava, inferior vena cava, blood will go over here, and from pulmonary artery, it will reach to your heart. But now understand what is happening over here. There is so much of congestion in your airways that there is too much of pressure in your lungs right now. So there is too much of pressure in your lungs. That's why the blood cannot get fully into your lungs, and that will going to build back into your right ventricle. Basically ventricle. And there is right ventricle hypertrophy associated with chronic bronchitis also. Did you understood something? Okay,
Yes.
let me explain you this thing again. What I'm exactly
Right
trying.
ventricle hypertrophy.
Yes, why this ventricle trophy is happening. So this is your lungs, okay. Okay, this is your heart. So as we have, there is so much of congestion over here, so there is so much of positive pressure. Okay, so whenever the blood which is taking your blood to your lungs, which is called as pulmonary
Artery.
very good, pulmonary artery. So when there is too much of pressure, though blood cannot get fully into your pulmonary system. Yes, pulmonary system. So blood will be back into your right
ventricle.
And this is called right ventricle hypertrophy, which is also called as cor pulmoni, which is also known as cor pulmoni. And you know what this cor word is associated with what? So what happened?
Filled with water, ma'am?
No, not water. Okay, this core word also come from a very history also. So when the physician looked at the patient's heart, or when they dissect the patient who died with chronic bronchitis, so when they saw their ventricles. It was very big. It was very big because there was a right ventricle hypertrophy due to blood pooling. So they had said, okay, this heart is looking like an heart of a cow or an ox. So the synonym of your core is come from an ox or cow. So there's like, so just like iske jaisa aisa dikhta hai na, so they started like core pulmonary, like a lungs of a cow or cow. That's why they call it cow core pulmonary. Okay, this is the origin of this word, core pulmonary. Like core, like an heart of an ox, because they have a very big heart chamber. So that's why they call as core pulmonary. Okay, pulmonary related to the lungs, as lungs, and now core means heart. You can just call it core. Understood? What are the sign and symptom? Can anyone tell me now? Because core pulmonary, right ventricle hypertrophy, you should understand. First sign
And
and symptoms.
edema, splenomegaly,
Respiratory
splenomegaly, right, sorry.
acidosis.
Respiratory acidosis, yes. But initial sign and symptoms start with shortness of breath, cough, less
Tachypnea.
exercise muscles.
Respiratory, high respiratory rate. Mental
Yes.
status changes.
But these are very, very late sign and symptoms. Okay, very, very late sign
Okay.
and symptoms when
Early
your body
sign.
is deprived
In
of
asking
oxygen.
about early sign.
Sorry? And you?
Cyanosis.
Yes, cyanosis.
Hypoxia.
Hypoxia, dyspnea, blue blotter. Blue bottle, right in
blotters.
capital.
Blue bottle.
Blue blotters. And feature of right heart failure or right ventricle hypertrophy, right side heart failure, which is also called core pulmonary. Okay, understood? So this
Yes,
was all about your chronic bronchitis. Okay, if I ask you, Rupa, what will the management of chronic bronchitis? What will say one management? Long-term management. I'm talking about long-term management.
Steroids.
Think like a nurse. Think like a nurse. Anyone can answer. If anyone can answer this question.
The first thing, because the
Bronchodilator. Anti-asthmatic drugs.
Yes.
No, ma'am,
And
anti-inflammatory.
antibiotics.
Asking you, think like a nurse and just say a long-term management. A long-term management. A very, very long-term.
Salbutamol.
Ma'am, respiratory support.
A more finer version of this.
Inhaler.
Oxygen,
Nebulization.
Right.
Nebulization.
Think
Inhaler.
ma'am,
like a
oxygen
nurse.
therapy.
Think
And
you are just targeting the sign and symptom. Everyone is targeting the sign and symptom. You're not targeting the disease. As a nurse, as a good doctor, you should always target the cause. The cause.
First of all, we have
Ma'am,
to stop the
because
smoke.
we try
Smoking
to teach.
cessation.
Stop,
Yes,
stop
yes.
the smoke.
Smoking cessation.
Yes.
Smoking
If a-
stop.
yes,
Yes. Think
By
like a nurse. Long term. Okay, for example, a patient is smoking and taking oxygen. Okay, 5 minutes smoke oxygen,
Wearing a
5
mask.
minutes smoking. Is it going to make any difference? No. Smoking cessation is not an easy thing.
Yes, ma'am. It's like
Nicotine
depressive.
replacement therapies.
You are asking about precaution,
Patient
ma'am,
will go
long-term
in depression
precaution.
as well.
Goes and depression as well for what?
Like if you
Withdrawal
want
symptoms.
smoking cessation,
Yes.
because patient is like depressive situation for him, like to quit smoking.
Yes, because you know what? Nicotine, somebody have told me that no, the smoking have nicotine. And yesterday, if you remember, I have told you about a receptor which is called nicotine and muscarinic receptors. So smoking affect your nicotinic and receptor, and this is the receptor which provide you calmness,
Yes.
cholinergics.
One of my uncle, he is like smoking a lot. Like in one day, he just I think 6 to 7 times he smoke. And they just try for nicotine tablets as well, everything. But it doesn't work at all.
It doesn't work.
Ma'am, we can say that we are avoiding the exercise or a high carbohydrate diet.
Yes,
in
these also things
COPDs.
matter. But okay, whenever something, if
Gassy
question asks
food,
you about
high fiber
long-term
foods.
Yes, whenever I
Okay.
listen, if there is an exacerbation of the situation, we would have gone for the cause. Okay, but if I'm
Okay.
asking you to treat something in long term, if I'm asking you uh to tackle a disease, you
And
should
ma'am, we are
always
also not given any live vaccine to the COPD patients in his disease. We can say that
you have to give I
in
won't
management, long-term management.
no, you have to give vaccination, especially you have to vaccinate the patient, okay, especially with your pneumococcal vaccine and influenza vaccine. Pneumococcal every
But
5 year, influenza every
I would
year.
read it anywhere in past study. One of
You
my
have
teacher
just
told me, we do not give any vaccine in COPDs.
Ma'am,
no.
ma'am, I think it is only because if the patient is taking corticosteroid, so it depresses the immune system only.
Yes,
Maybe that is
might
how
be
he is
this
thinking.
reason,
Maybe.
but if I'm concerning about Nclex, Nclex asks you to take like in immunization of pneumococcal and influenza every 5 year and every 1 year. Okay, in the month of October and November. This is very,
Okay.
and they have to get immunized because they are very prone for infection.
Okay.
That's why. Okay. And if the patient is long-term therapy of corticosteroids, then only we ask them not to take any kind of live vaccine. Only live vaccine. Okay. And this is all about. Okay. This is what we have studied about our chronic bronchitis. Next, let's talk about your